Okay, hello. Today we're going to be talking about another chapter in The Emperor of All Maladies by Siddhartha Mukherjee. And today, where I left this off, I ended with Hodgkin's disease. And now to further elaborate on that is with a Stanford professor known as Henry Kaplan. First off, during a cocktail party somewhere in Stanford University, Professor Kaplan heard of someone testing a linear accelerator, and for anyone who wonders what it is, it's basically an X-ray but taken to the extreme. Not only passing through tissue like the original X-ray did, but scalding said tissue to death. So basically, think about like heat vision if taken to a more higher degree, like Superman did in that one movie, but slightly less effective. And anyways, with this new form of radiology, Kaplan decided that he should treat patients with a bit of chemotherapy and radiology to get rid of the cancer. So, what to test? Which cancer to test it on? Whatever than Hodgkin's disease. Sorry, I pronounce it as Hodgkin's. Either Hodgkin's or Hodgkin's. What the hell? And anyways, he tested on Hodgkin's disease, and at first, and it actually worked. Well, for a bit, like all treatments at the time, they were temporary, but they were actually a bit long term. Most of the patients that went through this intensive, radiology and chemotherapy for at least a few months actually didn't have their cancer in the lymph nodes relapse until, say, a few years later or so. And Kaplan was getting closer, but he wasn't just there yet. Moving on to another step closer, which is back at the NCI, the National Cancer Institute, if you guys remember correctly. Tom Frey, we know his first name is actually Emil, but we'll just call him Tom because, it's what he's called. Tom Frey was researching a bit on how to on specific drugs that can be used to completely wipe out cancer universally, or at least some form of cancer. Like literally on one, in the whiteboard of his office, one column read all the types of cancers, and the other read a list of drugs / poisons that can be used as chemotherapy to cure cancer. And as a newer and fellow colleague at the time, Vincent Devita, he said that he and Frederick were unusually focused on trying to find a new cure for cancer. And as much as they tried to improve it, VAMP unfortunately couldn't really progress that further. And then the cancer development went to Devita himself, where he decided to pose a new way to combat cancer, a new VAMP. The combination of This is going to be a bit of a mouthful. Methotrexate vincristine, though we'll decide to use its its alternative name on COVID here, nitrogen mustard, and prednisone, to make a highly toxic cocktail, as Mukherjee himself described, MOPP. The M in there's an M instead of an N because, well, it's called mustargen officially, not just nitrogen mustard. And, well, it somewhat worked, and, well, the National Cancer Institute was against it for a bit, like they were with Frey and Freywick's for a bit, until Frey himself decided to intervene and say, hey, he's basically doing it just like us. You don't have to veto his decision, and thus left him alone. Devita then decided to take out the methotrexate and replace it with procarizine, and thus changing it from MOPP to MOPP. 2 P's, not 1, 2. And MOPP, well, is much more successful than MOPP. Out of the many people that were treated with MOPP, most of them effectively survived. And well, they didn't have relapses of cancer. And also what Devita proposes that, well, for those that relapse in the brain, inject them in the spinal fluid to prevent that from coming along, though it may risk the brain. And those successful patients ultimately relapsed with cancerous forms of Hodgkin's disease. Oh yeah, I forgot to mention, he tested on Hodgkin's disease. It came in the form of leukemia or other type of cancer, and most or all died. Which actually the more killing form is like nausea, instead of, well, the usual cancer going into the brain. It was nausea this time. Instead of, well, waiting a few months / years before coming back with complaints in the head and so, they literally die on the way back due to nausea. And that is not a good thing, really. And thus, MOPP, instead of being written as a success like VAMP, well, and likewise with VAMP, MOPP became a bit of a nightmare. And thus, without it, we'd pretty much be doomed to cancer. And that's where I would end my story, but someone actually decided to go forth and have the guts to, well, prolong the cancer treatment even further beyond than what other cancer treatments had. And this guy, the protege of Sidney Farber, is Donald Pinkel. Donald Pinkel, the protege of Farber himself, was hired at Tennessee's St. Jude's Hospital. St. Jude's, aptly named for the patron saint of the hopeless. Much like how Saint Nick is the patron saint of prostitutes. Look that up immediately. I didn't even get what I mean. And back to my story. When Pinkel arrived at St. Jude's, Memphis was okay. Think about it as a bit of a yin yang. If Boston were a yin, then Memphis was the yang. It was the reverse of it was a bit of the reverse of Boston. The negative. It was it was rather slightly chaotic with racial discrimination and segregation in place, along with some colorfulness and warmness, probably thanks to Graceland, Elvis Presley, and that colorfulness contrasted from Boston, and when Pinkel arrived at St. Jude's itself, the hospital itself was actually a bit underbuilt. Barely any employees and not really prepared at all. But thankfully, Pinkel soon made a cancer ward for patients of cancer and hired nurses and fellow doctors to assist them with treating these patients. Now, what Pinkel proposed is probably the most radical of all at the time. Because he looked back at all the previous treatments of cancer, and he was trying to see a common error that led to them to not be able to cure cancer in the end. And what he found was this. Conclusion 1. With Vamp, they cleared leukemia from the child's body, but there was the bloodstream in the head to deal with, especially with the brain. So what he proposed, and I misquoted earlier about Devita doing the same thing, injecting the cancer treatment drug into the spinal fluid, in which they can literally cleanse the brain from cancer and stuff. Conclusion 2. He saw that most treatments tend to last for months or even a year. To push right out of that boundary, he decided go for 2 or 3 years. Heck, maybe even 4. And this is by far the most radical, and most certainly a lot of people rejected it. But Pinkel did it anyway. Most people called it total radiology and cancer and chemotherapy. Well, as Mukherjee quoted, as us fellows called it, total hell. And in a sense it is, because chemotherapy is really painful. Even today, it is painful. And through lots of pain and hardships and so, out of the many people that Pinkel was able to induct into his study that had Hodgkin's disease or other forms of cancer, and yes, Memphis was able to provide that much, along with their hopeless cases. Pinkel basically forced them into chemotherapy intensely for about 2 or 3 years or so, and I believe it was one of the most painful in their lives, like the most painful times in their lives, but results showed because later, a third of them, which is roughly about 100 or so, never had the cancer, never relapsed from the cancer. They were completely cured from ALL, which was originally thought to be incurable. But now, Pinkel set in stone that ALL, despite being aggressive and hard to treat, is not uncurable. And thus I end my chapter and my reading here.
Okay. So you started with Vincent Devita?
And Vincent Devita.
Vincent Devita, who had a new cocktail of drugs?
Well, it's what Mukherjee described it himself as. And well, I have no knowledge of cocktails myself, but
a drugs a mix of the drugs. I forgot.
Yes, I believe that's what he meant. Mainly due to the fact that, well, it's due to the fact that well, it was mainly mixed together so that they can use it in cancer treatments and so.
So So it was mostly for the lymphoma, Hodgkin's lymphoma. Yeah. And
yes, because like it was between the border between liquefied cancer and solid cancer.
Okay.
Like the border between cancers like leukemia and cancers like breast cancer.
Oh, okay. What was the success rate? Was it good?
Yeah, but like most of the time, it naturally had most of the patients relapsed or so.
Oh, okay.
Ultimately, but the survival rate was longer.
Okay, so but even after you do the injection through the spinal cord?
No. As I said, I misquoted earlier. The Vita didn't do that. It was Pinkel.
Okay. So Pinkel was able to get 30% more of the people that did not relapse. 30 less.
Yes, and well, despite that being short of the whole entire population of people he treated, it was still a good amount, and it's a major step.
Okay, I see what you mean. Yeah, and it was mostly for a specific type of cancer, or because you say ALL, is that right?
Acute lymphomic leukemia.
Okay, the same thing that lymphoma.
Childhood leukemia.
Oh, the childhood leukemia.
Mm-hmm.
Okay. Mostly for this one, for the blood cancer.
Yeah.
Yeah. Okay. Oh, okay. So, but again, you say it's hell because it does reduce. It does attack the immunitary system. Is that right?
Yes, and actually I forgot to mention. MOPP also lowered the immune system and will eventually somewhat open a way to today something that we like to call HIV, and a disease we refer to nowadays as AIDS. Thank you, Devita.
So I'm sorry. What did he do with AIDS?
I mean, eventually it developed into HIV and AIDS.
What developed into HIV?
Well, more like it was discovered and so.
I'm sorry. You say what developed into HIV?
Well, because weakened immune system.
Oh, the win.
That stuff.
Okay, that's definition of the AIDS. Okay.
Yeah.
Okay, I got it. Okay. Okay, and you think from what you read, you think that chemotherapy is the most efficient way to get a chance to get cure.
I mean, it's the most efficient way nowadays too. Well, I mean, I'm not really up to date, but yeah, I think so.
Besides stem cell, you don't know that.
Yeah, I think stem cells are also a good solution, but they're still experimental at the moment.
Okay, so but when you say that, the best is not only to get chemotherapy, it's also to put it in the spinal cord in order to make sure that the brain doesn't have relapse there. That's the two things that need to happen. That's what you say. Okay. Okay, so at the beginning of this, you start with Kaplan and with radio. It was a combination of
radiology and chemotherapy.
What is the combination of this? What that means? I mean, did you radio and then chemotherapy, or
basically chemotherapy, and also using extreme X-rays to cut out tumors and so.
Or they do the both together. First, they use one of them, X-ray, and then they use chemotherapy or something. When was it discovered? This process. When was it done? The Kaplan and.
Crap and bad with dates. Probably around 1950s.
Okay, within the 50s. Okay.
Or 49 or 50.
Okay, that's good. That's good enough. Okay. Well, thank you very much then. So you still like the book, so?
Yep, I do.
Okay, thank you.
No problem.